Have you ever been told you need a medical procedure? Maybe something as simple as a filling or as big as surgery. That little knot of anxiety you feel, well, that's pretty universal. But the modern miracle that makes it all possible, that turns a really scary thought into something totally manageable, is anesthesia. So let's dive in and break down exactly how this whole thing works. So here's our game plan. We're going to start with the basics, what anesthesia even is. Then we'll look at targeted, regional, and total anesthesia. Think of it as a journey from numbing just a tiny spot all the way to a safe, controlled sleep. And finally, we'll see how doctors figure out the right choice for you. Okay, first things first, what are we actually talking about when we say anesthesia? Getting this core concept down is the foundation for everything else we're going to cover. Now, this definition might sound a little academic, but the two big words you got to remember here are reversible and response. See, anesthesia isn't just about blocking pain. It's about safely and, this is key, temporarily stopping your body's reaction to what's happening. The whole point is that everything is designed to go right back to normal when it's over. And this really shows you that an anesthesiologist's job is so much more than just stopping pain. They are actively managing your vitals, that's your blood pressure, pulse rate, and respiratory rate, the whole time, keeping you stable and safe from the very first moment to the very last. All right, let's start small. We're going to zoom way in. This first category of anesthesia is all about precision, targeting a very, very specific part of the body while you stay completely awake and aware. This is probably the one you're most familiar with, right? Think about getting a cavity filled at the dentist or having a small mole removed. That's local anesthesia. It's just a small injection that numbs a tiny, localized spot, blocking those pain signals right at the source. Now, the cool thing is, it's super straightforward and easy to do, which is why it's so common. But you still have to be precise. The dose has to be calculated very carefully. You want it to be effective, of course, but without causing something called local anesthetic systemic toxicity, or ALAST. That's basically when the anesthetic accidentally gets into your bloodstream. So local is fantastic for a small spot. But what if the surgeon needs to work on your entire hand or your whole leg? You can't just give someone hundreds of tiny injections, right? You need a much more efficient way to do it. Well, that's where something called a nerve block comes in. Instead of numbing all the little nerve endings in the skin, this technique goes for the main trunk line, so to speak. By injecting anesthetic near a major bundle of nerves, like the brachial plexus you see here, which controls the whole arm, doctors can numb an entire limb with just one shot. It's pretty amazing. And what's incredible is just how versatile this is. You've got the brachial plexus block for arm and shoulder surgery, an ankle block for foot surgery. Doctors can basically choose to selectively turn off the sensation to almost any limb on the body. Okay, so you can see how this is all building, right? We've gone from a tiny spot to a whole limb. Now let's zoom out even more and see how you can anesthetize an entire region of the body. We're talking everything from the waist down. This is where we get into spinal and epidural anesthesia. And as you can see from this diagram, both are given very, very carefully in the back, right near the spinal cord. This blocks the nerve signals for the entire lower half of your body. And the wild part, the patient is still totally conscious and breathing on their own, but they feel absolutely nothing in that whole region. So what's the difference between the two? Well, it really just comes down to timing. A spinal is like a one-and-done deal, a single shot that's perfect for surgeries that last about 2 to 3 hours. For anything longer, an epidural is the way to go. A tiny flexible tube, a catheter, is left in place, which lets the medical team give top-up doses of the anesthesia whenever it's needed, for as long as it's needed. And this difference in duration tells you exactly when they're used. A quicker procedure that's below the belly button, like getting your appendix out or a hernia repair, is a perfect job for a spinal. But longer, more involved surgeries like a total knee replacement or a hip replacement, those definitely need the staying power of an epidural. So we've covered all the types where you stay awake. Now we're moving on to the final category, the one most of us probably think of when we hear the word surgery. This is general anesthesia, where the patient is completely, totally unconscious. This right here is the absolute dividing line. With local, nerve, spinal, and epidural blocks, you are conscious. With general anesthesia, you are not. It's a reversible, medically induced coma that allows for the most complex, most invasive surgeries you can imagine. And this isn't just like falling asleep. Not at all. It is a highly controlled, multi-step process. It usually starts with breathing support, often with a mask. Then, powerful IV drugs are used to bring on that state of unconsciousness. And finally, muscle relaxants are given to make sure the body stays perfectly still, which gives the surgeon the best possible conditions to work in. So, when is this total approach needed? Well, a pretty good rule of thumb is for any surgery that's performed above your belly button. And yeah, we're talking about the most serious procedures here. Open heart surgery, complex brain surgery, major lung operations, all of these require general anesthesia. Okay, we have covered a lot of ground, so let's pull it all together now. Let's highlight the biggest differences that'll really help you remember how and why these different types are chosen. If you remember just one thing from this whole explainer, let it be this. The single biggest difference, the main dividing line, is the patient's state of consciousness. 4 of the 5 main techniques we talked about keep you awake. Only one, general anesthesia, makes you unconscious. Seriously, this is such an important takeaway. For most types of anesthesia, the default isn't being put to sleep, it's targeted pain blocking while you stay fully conscious. This table is basically the ultimate cheat sheet for the major surgical types. Just look at how the patient state, the duration, and the type of procedure all line up perfectly. Now, you won't see local or nerve blocks on here because they're for more minor or limb-specific things, but this shows you exactly how doctors weigh the options for bigger surgeries to make the safest call.
And there you have it, the 5 major categories of anesthesia, each one with its own specific purpose, which hopefully makes a really complex medical field just a little bit easier to understand.
You know, the invention of anesthesia was truly one of the greatest leaps in medical history. It turns surgery from this agonizing, brutal last resort into a precise, life-saving science. It really makes you wonder, now that we can safely turn sensation off, what's next? What does the future of pain management and sensory control even look like?